Morning, distinguished guests and dear participants. Welcome to our international webinar Pre-APFITA 2025 Series 5. We will begin shortly, so while waiting, please make sure your internet connection and audio are working well, and kindly rename your Zoom display name according to the format provided by the committee, name underscore institution. And thank you for joining us. The session will begin soon.
Ini nggak perlu ini. Saya belum live nih.
So, ladies and gentlemen, our webinar will be start. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Good morning, ladies and gentlemen. Welcome to the International Webinar Pre-APFITA 2025 Series Live with the team Generative AI for Health and Health Medicine. This event is proudly organized by Brand IPB also for the APFITA. Allow me to introduce Linda to serve you as your master of ceremony for today's webinar. We would like to extend our warmest greeting to our honorable guest, Dr. Ivan Rizal Sini, GDRM MS, FRANZCOG SpOG, Dean of the Faculty of Medicine IPB University, as our keynote speakers. Dr. Andi Saptono, Assistant Professor at the Health Information Management Department, University of Pittsburgh, USA. Dr.tech Wikan, Danar Sunindyo as the M.Sc Researcher at Engineering and Knowledge as STEI ITB. Dr. Mira Dewi, M.Sc, Vice Dean of the Faculty of Medicine IPB University as Panelist. Professor Dr. Yandra Arkeman, Chairman of Brain IPB and also APFITA 2025. And also Mr. Verry, Surya Hendrawan, Faculty of Science and Technology, Muhammadiyah Chilengsi University as our moderator. We are so delighted to welcome all participants joining us from Indonesia and abroad. Before we proceed to the next session, let us begin. This is the webinar rules. The first one, participant must use a Zoom account with the format name underscore affiliation. The second rules, mute your microphone during the session. And the third, question can be submitted directly by sending a direct message to the committee with the name committee underscore question or committee underscore question underscore 2. So we will move to the next, our agenda. Singing Indonesian anthem and also hymn IPB to all the participants, please take a respectful position. Thank you so much for the committee. And now we're moving to the next agenda. To officially open today's webinar, we are honored to invite Professor Dr. Insinyur Yandra Arkanan, M.Eng, the Chairman of BRAIN and also Chairman of APITA 2025, to deliver the opening speech. To Professor Yandra, the screen is yours.
Baik, thank you very much. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, distinguished guests, esteemed keynote speakers, Pak Dr. Ivan Rizal Sini, Dean of Faculty of Medicine, ITB University, and also Pak Dr. Wikan Danar Sunindyo, from STEI ITB, and also our special guest from University of Pittsburgh, USA. I've been there. I visited Pittsburgh 2 years ago and met with Dr. and Andi Saptono, assistant professor at University of Pittsburgh. And our respected panelists, Dr. Mira Dewi, M.Sc, also from Faculty of Medicine at IPB University, and also our great moderator, Pak Verry, Surya, Hendrawan from Muhammadiyah Cilengsi University. And of course, all valued participants joining us from academia, industry, government, and health and agricultural communities. It's my great pleasure to welcome you to the national webinar Pre-APFITA series number 5, focusing now on the insight theme Generative AI for Health and Herbal Medicine. This theme reflects a timely convergence between traditional herbal wisdom and cutting edge of AI innovation, bridging ancient knowledge with modern data-driven insight. From personalized herbal formulation to predictive health diagnosis, generative AI hold immense potential to enhance the precision, safety, and accessibility of healthcare. Throughout today's session, we will explore not only the technical and scientific foundation of generative AI, but also its ethical, cultural, and medical implication in promoting holistic and sustainable health solutions. We hope this event serves as a collaborative platform uniting researchers, clinicians, technologists, and policymakers to share insights, foster partnership, and inspire future innovation at the intersection AI, health, and herbal science. Thank you for joining us in these important dialogues as we continue our journey toward a smarter, healthier, and more sustainable future through the synergy of artificial intelligence and natural medicine. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much to Professor Yandra for your great opening remarks. Now we'll move to our next session is the keynote session. Please welcome Dr. Ivan Rizal Sini, GDRM MMIS, FRANZCOG SpOG, the Dean of the Faculty of Medicine of IPB University, to deliver his keynote presentation on generative AI for health and herbal medicine. Dr. Ivan, the screen and time is yours.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. Very good morning.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you very much for the chairman and the committee to invite me to deliver a keynote speech for this morning session, which is a very important session for our implementation of AI and also the future of herbal medicine. So allow me just to send my share. Can I share my slide? Would that be okay? Thank you. So, ladies and gentlemen, the era of disruption has already started, which I think all of us would agree that the artificial intelligence, despite this evolution for a long, long time, but COVID pandemic has definitely accelerated the implementation of AI in general, when we see the technology of a smartphone, ultra-fast computing, big data, and analytics, all of this are actually contributed to the daily life that we are actually facing at the moment, including the changes of the businesses. As we can see, one of the big companies in the world have actually shifted their business model. What used to be a conventional consumer-based product, but actually changed to become a healthcare and more digitalized. And this is not only just one, but applied to various other form of industries. In healthcare, as we know that we do see doctors on a regular basis, we do see medical professionals, and we are now very much relying on big data. And thanks to the days of electronic medical record, COVID actually have learned us that we need so much of disconnected world where we're now being more connected with EMR.
Zoom
It
di tengah hutan lagi kayak waktu itu.
gives us a very
Iya,
good
maksudnya di tengah kebun raya. Karena waktu itu kan juga berkendala sinyal nih, Pak.
Tolong
thank you.
tolong di mute.
So it actually has given us an opportunity to learn more about the way that we treat our patients, and this actually is expanding our horizon to become much more prudent to new innovations in the future. Now, what we see is happening in healthcare is very much the same thing as happening in other industries. But what we actually learn a lot more about ourselves now that we have data, we have genomic sequencing, and other information that is really quite astonishing to see in the scale of really exponentially to serve our science and eventually will deliver into an improved healthcare overall. And as what we can see, the artificial intelligence has been adopted in various forms in healthcare, including the inpatient and outpatient care. But beyond that, we see the pharmaceutical product, the development into consumer health, medtech development, and really quite exciting to see the digital health is really coming into play. And we believe that this goes beyond the care itself, but things like payment model, the health policies and services are actually part of the where the artificial intelligence will be our future. What we are seeing in several developed countries such as Australia, we see that the shift from conventional healthcare process where traditionally patients will come to see the doctors to seek for treatment, but now the consumers are being empowered, and that actually start from how to keep them healthy and also to provide a good informations about their background through digital informations and analytics of their genomic background. And this also would lead to reconfigure the workforce and how to maintain the life and the balance of work and lifestyle. And eventually, this will become a funding model, such as what we are seeing in Indonesia. Australia has a model, what they call as a Medicare model. So it's similar to the BPJS that we have in Indonesia. And this is something that the public and private needs to work together, how we can utilize the digitalized model that healthcare will be delivered. So let me talk, spend some time about the implementation of artificial intelligence in healthcare. So the personalized medicine is a very big topic, and we can actually see the personalized medicine should actually come from the the education level, and we go to the prevention model and how doctors can actually provide early detection more accurately, and eventually the therapeutic model is available should be more personalized, and in the end post therapy we need to have an improved quality of life. All of this will be something that we are hoping where AI would contribute. And what we're seeing at the moment, the adoption of AI in healthcare industry 4.0. And we see that this is not only implemented in clinical, but actually is implemented to how the hospital operators are using AI to improve the services, but also how the payment model is actually utilized well to justify how much money needs to be spent into the community, especially improving the quality of life, when we know that countries like Indonesia are really highly dependent into access, but we also have a limited budget, and that is why I think it's important how we can maximize our opportunity with the government's transformation initiatives, and they have 6 strategic pillars, which includes one of them being the healthcare technology. So just to elaborate on this, artificial intelligence is one of the key elements that the government is trying to look at into data-driven initiative, and that has given us various information about such as from Satu Sehat, where we see the information about where the patients, the highest incidence of cancer, the highest incidence of stroke and cardiovascular disease, including where the incidence of maternal mortality, neonatal mortality, and other important data for public policy. So let us start how the digital transformation can help from the preventive perspective. As we can see here, many of us are quite accustomed of using the mobile phone that is connected to our wearable devices, and that is something that's quite easy now these days to access, and that helps not only the patients to understand where they need to see the doctors, but also to help the doctors or the health professionals to provide early detection, such as ultrasound scan, mammograms, and so forth. And when the patients have, come to a position they need to seek doctor's advice, nowadays, as we know, ChatGPT and generative AI has assisted not only patients but also the doctors to provide information that is highly relevant, but also needs to be evaluated about the accuracy, because obviously the information that is provided needs to be quite well calibrated. And nowadays, the implementation of artificial intelligence robotics actually have been widely used. And Indonesia is also part of that move as well. And myself have been involved in this robotic procedures for the last nearly 15 years now. And we see that the rapid increment of the implementation of robotics is definitely sort of well applied to many hospitals in Indonesia, and AI definitely something that would be used quite frequently in this type of procedures. And another angle of what we see in therapeutic model is that the genomics development, we can see that the genomics actually have contributed quite significantly to personalized medicine, such as in oncology cases, where in cancer patients in the US, breast cancer, lung cancer are now already treated quite precisely with genomic-based therapeutic models, and this has been one of the key success of eradicating major cancers, and I think this is something what we're seeing in Indonesia as well. In my field, the reproductive medicine has already implemented AI, and we actually have been our group have been working quite sometimes to look at how to implement time-lapse technology to predict the best embryo to have highest implantation potential. And all of this very much available, and also I think it's a good opportunity for us to look at various industries in healthcare and to point out that all I mentioned before are more in the clinical side. But when we look into the pharmaceutical development, we see the growth of pharmaceutical industry is really quite astonishing, and especially Indonesia with large populations, we see that a potential for us to contribute in pharmaceutical development. However, we see that the phase of clinical trials in the world is time consuming and also quite high in resource, particularly from the cost viewpoint. it takes a long time. It requires a heavy investment. And again, with the pharmaceutical, it's a really big industry and mostly are actually monopolized by big players. However, pharmaceutical industry have looked at AI, how to improve and reduce the inefficiency and to become much shorter and less costlier. And hopefully, this will make our product or drugs become more accessible and much cheaper. However, we have obviously issue that we are not heavily involved with many of the big industries because obviously with the long-standing development that they already invested in the world. However, we do have the advantage that herbal medicine being one of our tangible values that actually we have inherited from our ancestors, that we have acknowledged that herbal medicine is recognized by the government by Peraturan BPOM. But also this is a recognized therapeutic model that is recognized by the strong bodies such as NHS in the UK. However, we do see that the length timeline that we observe how the quality medicinal herbs that that's used globally is obviously something that is relevant to how we can actually provide a good clinical evidence, because at the moment the biggest challenge that we have with the historical use of herbal medicine or in the form of jamu is how we can actually translate it to become a proper clinical evidence that we can use to convince medical communities. And one of the biggest challenges that we are lacking of proper studies. When we have one good product, we say immediately, oh, this product is good for cancer, for diabetes, for thyroid, for everything. We know no one medicine fits for all. So we need to really have a good proper study. And as we can see here, we know ginger is quite good for nauseous in pregnancies. But if you see the number of publications is very much similar by using only small populations, small subjects, and this is not going to be adequate enough to convince global industries that herbal medicine is here to convince the conventional medical society. However, we can use AI to actually utilize this in more technology-driven process, where we can see the good genetic profiling of the patients' populations, but also the genetic profiling of the actual herbs that eventually will become something that were quite relevant. But we still need to apply a proper process, but that will help us to drive an AI-based discovery system, where our colleague from Gajah Mada has already published a paper, but I think it's very lacking of interest, unfortunately, how we can actually use this drug discovery model as good research and good clinical research practice that needs to be implemented well. However, the opportunity that we have, knowing that many of Indonesians are actually using herbal medicine, we need to justify well how to tell the community that the herbal medicine is good, but also in the same time, we need to advise the community if the herbal medicine is a product that is creating a placebo effect. And we have to be, as a scientist, needs to be quite clear about our message. So, ladies and gentlemen, to conclude, I think I'm very excited and very happy that I'm invited to provide this key lecture for this morning. But I'd like to share my biggest excitement that we have an opportunity in Indonesia, despite that the global industry is leading toward a very ultra fast move in AI, particularly in the pharmaceutical development. But in herbal medicine, I think because of long-standing history that we have a good opportunity to convince our community with the good science that we can establish a really a good this drug discovery model that eventually will become our asset that will be utilized properly, not only in Indonesia, but also globally. And this is something that we can use as a personalized, data-driven, and culture-grounded healthcare. With that being said, I think I would like to conclude by saying thank you very much for inviting me one more time, and billahi taufiq wadaya. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Dr. Ivan, for your enlightening and visionary keynote presentation. Okay, now we will move to this. Our agenda is a group photo session. So please, everyone, if there's no, you can open your camera. Maybe I will ask the committee to help me to take the picture. Okay, we have first screen. Okay, the first screen. We'll take a picture. Please give your first smile. 1, 2, 3. Okay, the next slide. Once more. 1, 2, 3. Once again. In 1, 2, 3. And the last one. 1, 2, 3. Okay, thank you very much for your comment. Okay, now we will move to our main presentation and discussion session. That to guide us through this part, we will please welcome our moderator, Mr. Verry Hendrawan from the Faculty of Science and Technology, Muhammadiyah Cilengsi University. We will serve as our moderator. Allow me to briefly introduce Mr. Verry Hendrawan. So, Mr. Verry Hendrawan is a researcher at IPB University and also a lecturer, also the commissioner and many professional experience. The formal education on now, Mr. Verry Hendrawan is a doctoral degree ongoing in agro-industrial technology in IPB University. Worst ever experience, Mr. Verry Hendrawan worked over 20 years of experience in the manufacturing industry, including Astra, NGK, Mel Jensen, and also Target USA. So we now hand over the session to Mr. Verry, who will lead the presentation and discussion. So, Mr. Verry, the screen and time is yours.
Thank you, Master of Ceremony, Mbak Tere, for a great opening. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen, distinguished speakers, panelists, participants from around the world. I noticed from USA, from Australia are joining. Dan terima kasih Pak Dekan sudah berkenan memberikan keynote speech. I believe you are very busy. You are in Central Java now in Yogyakarta actually and going to deliver class session in UGM. Thank you so much again Pak Dekan. All right, welcome to the 5th International Webinar Pre-APFITA 2025, proudly organized by BRAIN, IPB University and Agro-Maritime Logistics Study Program. With today's fascinating theme, Generative Artificial Intelligence for Health and Herbal Medicine. My name is Verry Hendrawan from the Faculty of Science and Technology, Muhammadiyah Cilengsi University, and it's truly an honor for me to serve you as a moderator for this morning session. Today, we gather in this digital forum to explore one of the most promising intersection of modern science, the convergence of artificial intelligence and health innovation, particularly in the realm of herbal medicine. As the world continues to advance toward personalized healthcare and sustainable solutions, AI offers not only efficiency, but also deep insight into biological system and traditional medicine knowledge. We are greatly privileged to have with us an exceptional lineup of speakers who will share their knowledge, research, and vision. Speaker number 1, Dr. Andi Saptono, Assistant Professor at the University of Pittsburgh. Speaker number 2, Dr.tech Wikan Danar Sunindyo for STEI ITB. And our panelist, Dr. Mira Dewi, Vice Dean for Academic, Students, and Alumni Affairs, Faculty of Medicine, IPB University. And later on, we'll also have a closing speech by Prof. Yandra, who will wrap up today's enriching discussion. So before we begin, I would like to remind all participants to stay engaged through the session. Please pause your question, so you are allowed to share your question in the Zoom chat box, and we will address them during the QA segment after the presentation. So now we are moving over to our first invited speaker. It is my great pleasure to introduce Dr. Andi Saptono, an assistant professor at the Health Information Management Department, University of Pittsburgh, USA. Committee, please show the his amazing curriculum vitae. So we can read the detail on his impressive curriculum vitae as shown on the screen. So Dr. Andi Saptono has been deeply involved in research and system development for digital health, health informatics, and AI-driven decision support system. Today, he will share his perspective on how generative AI can enhance health data integration and clinical intelligence in modern healthcare system. Without further ado, let us begin with our first session. Please welcome our first speaker, Pak Andi. Are you ready?
Yes.
Good
Thank you so much.
evening, Pak Andi. I believe it's approaching 10 p.m. in USA. I'm sorry for keeping you awake, but your presentation now wait for by everybody. So, Dr. Andi Saptono, the screens is yours. Please, Dr. Andi.
Thank you, Sam. Thank you very much, Mr. Verry, Surya, and thank you for the opportunity to give a short talk about this. My name is Andi Saptono. I'm from the University of Pittsburgh, and we are in the Health Informatics Department. And right now, our main focus of research is in the generative AI. Traditionally, we were in the health informatics, and that domain has evolved. And we keep on introducing more informatic technology into health, and the latest, of course, the latest and the hottest out of the research right now is about the generative AI. And I mentioned that with Mr. Verry as well as Dr. Yandra, and we were thinking maybe we should bring this topic out so that we can share what we learned over here to give a little bit of a vision of what to expect next. That's going to happen in the generative AI for health. So I'm going to share my screen so we can go through the topics together. Okay. All right. Can you see my screen right now?
Yes, clear.
All right,
Pak Doctor.
Okay, thank you very much. So a little bit of just where I am right now. So if the United States map is over there at the middle of the screen, Pittsburgh is sort of in the middle top right corner of the map, and it's close to New York, close to Washington DC, which gives me a lot of opportunity to go to the embassy, for example, and meet our ambassador for the United States. And it just so happened that yesterday we have a meeting with the ambassador, and he shared one of the focus and one of the vision that the president have is to have more AI as a part of the Indonesian's research. So I'm very happy that it seems that the interests align for this topic as well. So quite excited about that. These are the three topics that I would like to share today. I think our keynote speaker have given a really comprehensive vision about the AI. So I want to focus a little bit closer to the generative AI, of what is it and why we think it is important. And I would like to expand the applications of generative AI in health and healthcare over here in the United States, as well as how we prepare our human resource over here at the United States to be able to handle the generative AI for health, especially because In our department, we have a lot of students in the health informatics program. We want to also prepare them to be ready for health AI, and these are some of the competencies that we educate them with, so that they are ready when they graduate. They are ready to handle the generative AI for health. So I think the definition is the boring part. I'm sure that everybody's have heard about this, but the idea of the generative AI is that by learning the patterns from the existing data sets, we've heard about the big data as being the key factor in the emergence of the generative AI. And through the advanced algorithms such as the transformers or generative adversarial networks, which most of this comes from the deep learning path of the machine learning, and the convergence of the computation, the high computations availability, the advanced algorithm, and the data. These three are the one that triggers the boom of the generative AI. Without these three components, this generative AI won't even be in existence right now. So what is the difference between generative AI and the traditional AI? In the traditional AI, we usually predict. We usually use it to analyze, predict, classify data set, and using those models to predict from a new data what would happen if that new data is being objected or subjected to certain interventions. In the generative AI, we move beyond just these assistive roles of predicting to content generations, new content generations, and workflow automation in clinical settings. So we are using this as a creative and constructive agent that can generate new original output. And this allows us to build or synthesize realistic text, image, or data. So we can go beyond just decision support to simulation and many novel content as well. These are the trends of generative AI for health in the United States for 2025. I'm sure that going into the 2026 in a couple months, we probably will see better or different trends based on what we have achieved this year. But this was some of the trends. So we see widespread implementation. I see generative AI being used in hospitals and health systems right now. If I met my clinicians and doctors right now, they already use AI, generative AI, such as the ambient listening, for example, that listens to the doctor's encounter and automatically transcribe and prepare all the documentations in real time, while the doctors can assess, can communicate, can engage their patient, freeing up their time, giving them more time to pay more attention to their clients and patients. We see a lot of advanced integration, which combine the multimodal AI. So not only just using text, but it's a combination of text, imaging, and genomics for holistic patient care. And when our keynote speaker today, Wikan, mentioned about the spectrum of health, I remember this joke that my colleagues usually share. In that, in the past, we should have called our domain a sick care, because our primary goal is dealing with sickness. But nowadays, because of our goal, our vision to provide more healthy care during healthy time, we want people to stay healthy. Only now we start moving from that sick care into healthcare. So I think that's a really, really good vision of where we want to move and how holistic patient care can really, really utilize the generative AI to make it happen. And a lot of the operational transformation happens as well as a part of that. There are process where this generative AI starts to analyze in combinations with ambient listening. For example, they also analyze whether the proposed intervention or the proposed treatment match with the patient's condition as well as the availability of the resource. over here we have an extensive reimbursement process. So the idea is, with the patient's informations captured through the ambient listening during the encounter and the intervention or the treatment being proposed to intervene for that situation, would this pass the authorization process in the future, so that if the AI detected that this particular intervention would not pass that prior authorization, they can provide a better recommendations to the clinician so that they can adjust their treatment better, personalizing it for the person or their client. And that leads to the next point, where the personalized care with AI-driven health assistance for scheduling, symptom monitoring, and medication adherence becomes more and more prevalent. The generative AI also show us that they can conduct simulations and planning. So surgeons using AI-generated 3D models for preoperative planning and training becomes more and more prominent, mainly to allow the surgeons to be prepared for all the scenarios that could potentially happen during the surgery, and that prepares them with strategy to deal with those situations when that happens. And on the data governance side, we also have stronger regulatory frameworks and ethical guidelines to ensure the fairness of the model, as well as ensure the data security of the data set that is being used to train those models. And so why does generative AI matters, right? We've seen the trends, and these are the key aspects that we think makes generative AI matters in health. We see a transformative potential from generative AI to revolutionize clinical decision-making, providing those simulations, allowing clinicians to really personalize their intervention. The capacity to create synthetic data also can support research. So situations of conditions that have very little number of occurrence or incidents. I'm in the field of rehabilitations, and I work a lot with individuals with disability, and the data that we see mimics exactly what with the keynote speakers presentations. Only 30 individuals, 40 individuals for a particular assistive technology. And this kind of situation is difficult to use as evidence to change policy, because people will come back to me and say, well, this only works for 30 individuals. How about expanding it to 100,000 or 1 million people before we start thinking about the policy change? And the previous case that I mentioned before about the prior authorization process, that reduced administrative burden. Our clinicians needs less time to document their process, which means they have more time to engage their patient, as well as reducing what we call the pajama time. The pajama time is this time where clinicians prepare outside of their working hour the data, the information of their patients, so they can provide a better care for their patient. The AI allows this process to be more optimized, so that this translates to the reductions of burnout as well. And I mentioned about the simulation, as well as the ability or the capacity to enhance communication. Imagine that you are a clinician. You've worked for 12 hours, 8 hours, and at the end of your shift, suddenly there is this email or a notifications message coming from your patient asking about something. You're probably very tired, right? And you probably will respond in a very, very strict or even harsh message, because you're already very tired and you want to go home. With the generative AI, this can be intercepted, and those messaging can be made more empathetic, can be clarified, and can be made easier to read, which bridge basically the communication between the clinicians and their patients, and making their relationship better as well. So those are the opportunity basically that the generative AI opens in health. And I'm going to share a couple of the example of how we're applying the generative AI in health right now that mimics those opportunity. The first one is about the synthetic data generation. One of the challenges in sharing data right now, especially in the United States, is that we consider healthcare data to be secure, protected because of the identifiable data. And we do not want to share those identifiable information. And because of that, it's very difficult to combine and to build a stronger evidence due to the siloed data. With generative AI, the generative AI can learn the pattern and the trends of those data and generate a synthetic data that mimics the trend of the real patient data, but without the identifiable information. And this identifiable information can be shared because it is not a real patient data. It mimics the trend, it mimics the property, but it is not the real patient data. And this allows us to combine and build a stronger evidence for our intervention, for our cases that potentially could impact policies, impact reimbursement process, and by combining data from across institutions. This data can also be used for research and model training, so helping us build a better AI model. It also allows us to balance the distribution. So for example, when we want to minimize the bias of our model, we need to make sure that our data are not biased as well. So the synthetic data generation can help balance the data so that the data is not biased. Imagine that if some model is built using data from Caucasians, and we want to use this model to treat Black individuals, there might be bias that are inherent in the data from Caucasians populations that can prevent a correct or personalized intervention for the Black population. So the generative AI allows us to balance those data so that we have a better model. We also use that to enhance medical diagnosis, and my colleagues from the radiologists are the pioneer and the most advanced in this domain, and they use technique from the generative adversarial network, for example, to improve medical imaging, to enhance the resolutions, reduce noise, segmentation, and detect subtle patterns and anomalies from imaging that allows them to be more efficient in their process, and allowing them to handle more data and more patients as well. So scaling up their capacity. The AI model can also detect subtle patterns and anomalies, and this one was, I personally was surprised with AI's ability to do this during COVID. So in our clinic, we had a situation where the AI said that one of the respirator, which was used to connect and to help some patients that have COVID, they said that there is something wrong with this particular respirator. All the clinicians, all the technologists look into the data, they don't see anything wrong. But since the AI flagged that particular respirator, one of the technicians go in and check that respirator, and turns out that the filter, one filter out of all the filters for that respirator has hole in. Nobody knows. The data does not seem to be different with other patients that currently are encountering COVID, but the AI can detect it. So I was amazed at how the AI models was able to do that. And we also use large language model to extract clinical insight or uncover undiagnosed condition from our clinical notes. And as I mentioned before, we can convert encounter conversations into clear, empathetic, and natural language summaries for clinicians and patients that they can review and enhance the communications and patient understanding of the diagnosis as well as their treatment plan. I already mentioned about the clinical documentation and administrations, saving time, giving more time to our clinicians to engage their patient, basically making our care humane, more humane compared to before. We see a lot of opportunity for personalized medicine and engagement. We enhance our patient engagement by providing a notifications that make sense, that fits into a person's context. We are able to improve adherence and empowers patients to own their health through interactive tools, through AI. So the health outcome of these individuals becomes better as well. And I think the idea of accelerating drug discovery has been mentioned before, and we've seen this happening as well. I have a college that oversee a new lab development that focus more on building evidence for alternative medicine, and as part of the alternative medicine, herbal medicine is included as well in that lab. So we're able to efficiently identify candidates, for example, that match a certain profile that we think a specific chemical variations would impact their health better. So the AI help us identify those candidates and also generate simulation. If this particular medications is being provided to this profile, what would happen? The generative AI is able to take that and build scenarios and simulations that allows us to see what could happen or what needs to be addressed to prevent certain situations from happening. The generative AI does not come without risk, however. So I mentioned about synthetic data generation. If the data that we use are not safeguarded, then this synthetic data generation can expose sensitive health by process of re-identification. And if we think about large language model that is being trained with data available from the internet, they absorb all the social media information, all the text from social forums and things like that. The AI could potentially reconnect all the dots and guess who the person is behind a specific data set. So those are the risks that we need to be aware of and create robust safeguards so we can prevent the re-identification. A lot of the generative AI model are black boxes, and this lack of explainability behind it can undermine the trust and make clinicians slowly adapting to this model, which may impact the implementation of the model in the care as well. Hallucinations are not a bug of generative AI. It's actually a feature, and it is difficult to catch that, especially if the person has little knowledge about the domain. Imagine that a radiologist that uses generative AI versus a layperson that uses generative AI. A radiologist probably can identify an error or a hallucinations that generative AI built and prevent that from impacting their decision. But if a layperson that does not know anything, they probably will consume that hallucinations as a face value, and that can create a harmful decisions for their own health process. And bias, I mentioned before, can happen if the training data set are not equal, but also the use of advanced AI tools may widen the gaps between a well-funded institution and resource-limited setting. So there is this inclusivity that we actually want to bridge, but if we're not aware of this risk, we can even widen the gaps between a well-funded institutions and the resource-limited setting. So those are risks of generative AI health that have a real ethical implications to our daily usage of AI. Now, to ensure that our students have the competencies to handle both the opportunity as well as those risks, these are the 6 key competencies that we educate them. So we educate them in the basic AI knowledge. We are educating them in the awareness of the clinical, technical, economical, and ethical implications of generative AI. We train them to use tools so that they can evaluate the evidence, the AI tools. So what are the evidence behind the AI tools? How can they evaluate whether the AI tools works or not, produce hallucinations or not? How can they validate the result of those tools as well? Those are the skill set that we need to be able to assess the AI tools coming into the health and healthcare domain. And then we also educate them on how to implement and integrate AI as a part of the health ecosystem workflow. So not only just buying and then giving it to the clinicians, but also finding exactly where in the workflow that the AI would work best. And then we also educate them to understand the practical skills of AI to enhance health events, whether it's an encounter or a follow-up or maybe a pre-encounter. Those are the health events that we want to enhance using AI, and the skill sets to allow our students to be able to support those health events are being trained as well. And then, of course, the strategy to continuously learn because of the very, very fast evolution and progression of AI and AI tools. These are some of the use cases that we educate our students. So the data managing, building performance analytics, always until this, how we can use the AI to support clinical decision making. And just a little bit of snippet, this is one of the case of why we need to educate people on the use of AI, generative AI for clinical decision making. For example, if I have a patient, Peter comes to Brian because they have a knee issue. Brian probably wants to use AI model to help them predict whether we need to perform knee replacement or not. If the health data scientists run that AI model and got that the chance or likelihood that Peter will have the knee replacements in the next 2 years of 76% on the right side and 22% on the left side. That's in the next 2 years, right? The black box model of the AI model probably comes up with the 76% from many combinations of chances. And if we just simplify that, it is possible that the health data scientists only simplify it to either no surgery needed or surgery needed, because we want to make it explainable and easy to understand. And because it is only in these 2 categories, the AI model probably predicted that for the very next year, there is no surgery needed for Peter. However, behind that no surgery needed, it is possible that the AI model output is actually only a 52 versus 48%. So because the 52, the no surgery needed is higher, therefore the AI model output being simplified, it says no surgery needed for the next year. So, and if you think about it, 52% chance for next year and 52% chance for the next year, if you combine it together, is 25%, which means that explain why we have that 76% need of knee replacement in the next 2 years, right? So if we do not give this output, this chance as well to the clinicians probably unaware of that low certainty, accept the decision at face value, which can lead to a worse situation. So the key highlight is that our student needs to understand the situation, and they need to understand as well that simplifying AI is not just providing an easy to understand data, but also providing the reason behind it. So that is all my highlight for this topic, and this is my contact information. If you want to reach out and have more discussions, feel free to send me an email at that occasion. And thank you very much. And I'm returning the screen to Mr. Verry.
Thank you so much, Dr. Andi Saptono, for that truly enlightening presentation. Your discussion gave us a clear understanding on how data-driven technology and AI, generative AI, can transform healthcare system and patient outcomes. By the way, I love your words of health AI competencies, of health generative AI competencies. Those 6 important points to be acquired. All right, let's now move on. Dr. Andi Saptono, I know it's late in United States, but please wait because we start a second speaker and we'll have a question and answer session. Please wait, doctor. All right, please stay with us. Now let's move on to the second speaker. It's an honor to introduce Dr.tech Wikan Danar Sunindyo, Senior Lecturer at School of Electrical Engineering and Informatics, STEI ITB. We can read the detail of his outstanding curriculum vitae as shown on the screen. Kamite, please show the screen. All right, so here's the detail. Dr. Wikan specialized in knowledge engineering, software system, and artificial intelligence. In this session, he will share his thoughts on engineering knowledge frameworks and how generative AI can support innovation in health and herbal informatics. So without further ado, please welcome our second speaker, Dr. Wikan. Please proceed. The virtual screen is yours. Please, Dr. Wikan.
Oke, thank you Pak Verry. Assalamualaikum warahmatullahi wabarakatuh. For first, I want to share my screen. Just a minute. Okay, can you see my presentation?
Yes, it's clear now, Dr. Wikan.
Okay, great. Yes. Today I would like to present my presentation about generative AI for health and herbal medicine, from natural intelligence to generative intelligence ecosystem. And fortunately, we just have a conference, international conference on data and software engineering, the fifth one, in Batam a few days ago, and the topics of the conference is about the generative AI, and because I think it is very interesting and also high demanding. So I think it is very nice that we have a complete view from the first keynote speaker, Pak Ivan, and also Pak Andi, about the using of the generative AI in health care. It is very interesting that I also learned from Pak Andi that it's in USA the generative AI is very useful, in healthcare and also hospital. But let me have another perspective, because this is my background. As mentioned earlier, that my name is Wikan Danar Sunindyo. I am a lecturer and researcher of Knowledge and Software Engineering Research Group in ITB, and I am also the head of Metaverse Laboratory of School of Electrical Engineering ITB. And because of this, so I am actually more focused on the metaverse and digital twin, helping some of smart city in several regions in Indonesia. Yeah, also I am a chief editor of GDRM ITB. I graduated from informatics ITB as a Pak Andi, and I continue my graduate my master study in computational logic at Dresden, Germany, and continue my doctoral degree in informatics in Vienna University of Technology or Dewi in Austria. You can also contact me via my email, wikan@informatica.org. So I think this topic is very interesting because we are now witnessing a global shift toward natural, safe, and personalized therapies. Yeah, and then you can see that people looking for treatments derived from nature. So because yeah, they sometimes want to have an alternative, they want to have a different perspective, they want to acquire herbal, yeah. But the thing is that it's not supported by the scientific validation. So there's a rising demand for natural, safe, and precision therapies. But the thing is that the traditional process of developing new drugs can take 10 to 15 years, yeah, and also the costs are extremely high. That's why it take very long time, yeah, to make all process validated and also very expensive. Why we use AI to make the process shorter, so the AI can shorten the timeline to just 3 up to 7 years. So almost 1/3 or half of the whole years for processing the drugs. And then we can see that by combining the herbal knowledge with the artificial intelligence, the result is accelerated discovery. We can turn centuries of traditional wisdom into modern, more modern and evidence-based medicine. Here we can see that generative AI is transforming how we explore herbal and pharmaceutical discoveries. It started from the literature mining, where we can use AI to scan millions of scientific papers to uncover patterns and insights hidden in the text. Because we know that there are already a lot of different literatures from the ancient century until now, yeah, a lot of traditional and very old document about the herbal, and that we can go into detail by using the literature mining. And next is molecule generation. Yeah, we continue to molecule generation, where model designs or optimize natural compounds with desired properties. Yeah. After that, we go to biosimulation. We can use AI to predict how these molecules interact with the biological system. And we can reduce the need for costly lab trials. So this is very important, since the using of AI here make the process of deriving the drugs or medication is become less expensive, yeah. And finally, knowledge graph reasoning here, as we can see, connects all the information about the plants, the compounds, and the disease to reveal the new therapeutic possibilities. And here together, these capabilities accelerate innovation from the data to discovery. Yeah. Here we can see that in the world of health and herbal innovation, the artificial intelligence doesn't replace the expert. So we still need the experts. The AI is not threat to the experts, but it support, it helps how the experts to discover the drugs, yeah, how they can heal the patients, how they can cure the disease and so on. Yeah, by using the AI, it augments the expertise knowledge. Yeah, AI also can help process vast scientific data, identify hidden links, and suggest new hypotheses, while human experts provide interpretation, context, and also the judgment. And here we can see that the human in the loop validation become essential because we need the expertise from the human to validate what the AI discovered. Yeah, every AI insights must be reviewed and verified by clinicians, pharmacists, or the herbal scientists. And to make this collaboration trustworthy, we must ensure that there are trust, yeah, transparency, safety, and also auditability in every steps. Yeah, we should be able to check, yeah, every process, every steps that take, yeah, and make it transparent so all the people, all the experts can see, yeah, and make a review and also giving some arguments or objection if it is not valid or it is not right. Yeah, they can argue on this step. So there's nothing to be afraid or nothing to be hide. Yeah, everything is transparent. So here means that AI not we don't leave AI work alone. But here, humans and AI working together intelligently and also ethically. Yeah, here before we can apply AI to herbal medicine, we need a solid foundation about the knowledge engineering. Yeah, we need the knowledge engineering since yeah, I am also from the knowledge and software engineering, and software engineering. We want to know, yeah, from the beginning, we transform the data into the information and information into knowledge, and also from knowledge to wisdom, yeah. And started from the ontology, yeah. We built ontology for plants, yeah. We want to know the structure of the plants, yeah. We will build a structure map linking to the plants, what are their chemical compounds, what are their benefits, yeah, and so on. And after that, we use neuro-symbolic AI, yeah. Here, in neuro-symbolic AI, we combine the pattern recognition power of deep learning with the logical reasoning of symbolic system. And after that, we continue to causal reasoning. Yeah, we move beyond correlation to understand why and how certain compounds works. And finally, we have here the expert validation. Yeah, to ensure that every AI insights aligns with the scientific accuracy and also the traditional wisdom. And together, those elements turn scattered herbal knowledge, yeah, taking from literature and so on, yeah, into more structured, trustworthy, and also AI-ready intelligence. Okay, and we also use the Graph, yeah, Graph AI, yeah, for herbal bioinformatics. Here in herbal medicine, yeah, we can derive what is inside of the one plant. Yeah, one plant can influence multiple biological pathways, through many different active compounds. Yeah. So to understand this, we use the graph AI. Yeah. Here the graph represents such a relationship from plant, yeah, to compound, and then next is a biological target, and then the benefits, yeah, the health benefits that reflects the true multi-target nature of herbal system, since one plant can have multi benefits, yeah. Then after that we have graph neural networks, yeah, GNN, to uncover hidden biological patterns that will be difficult to detect manually. Yeah, and here we can identify promising compounds and mechanism of action. Yeah, this approach is already used in drug repositioning. We will explain later. Vaccine research and also cosmetic bioactive discovery. So we will use for drug repositioning, vaccine, and cosmetic here. Together, yeah, we can say that the graph AI gives us a powerful way to transform herbal knowledge into scientific insight and also real clinical potential. And after that, we continue to the herbal intelligence pipeline. Here we have 5 steps, yeah, starting from the literature and ethnobotany, yeah, where large language model extract knowledge from scientific papers and also traditional herbal manuscript, yeah, the ancient manuscript. After that, we construct knowledge graph, yeah, that we can use to link plants, compounds, target, and health effects into structured networks. Then we use GNN, yeah, to predict potential new relationship and therapeutic effects. And after that, we continue to validation, yeah, where experts and also lab data confirms the findings. Finally, then we have the formulation, yeah, the validated insights transform into real-world formulation, where herbal medicine, nutraceuticals, or cosmetic can be the results. These pipelines bridge tradition, science, and also AI into one of innovation flow. Okay, then we continue to several case study that we have. Yeah, we have several research, yeah, led by Ibu Putri Saptawati, yeah, and she also has presented in last conference, yeah, the power of graph-based machine learning in big data. So she has some works, yeah, with the data of drugs, yeah, and also herbal, yeah, and also vaccines, yeah, together with some pharmaceutical company and also some laboratory. So here the case study of drug repositioning, where the AI can reduce discovery time. Yeah. Here we can find new therapeutic uses for existing compounds, including from herbs. Yeah. Traditionally, this process could take years of manual research, but with AI we can reduce that to weeks. Yeah, by combining the graph neural networks and also large language models. Yeah, AI can uncover hidden connection between drugs, biological targets, and disease. Yeah, this is the links, yeah, between the drugs. Yeah, and you can see that there's also drug and side effect, drug and disease, and altogether, yeah, here we can find a new relationships between the drug and drugs, yeah, for instance, yeah. So and also compound, yeah, for example, a compound once known for anti-inflammatory effects might show potential for treating neurodegenerative or metabolic disorders. This approach can bridge herbal knowledge and modern pharmacology, turning non-natural compounds into new evidence-based therapies. Okay, and the second case study, yeah, is a study about the using of Hoya, yeah, Hoya flowers for cosmetic, yeah. We want to know what inside the Hoya flowers, whether they have bioactive compounds and whether there are some benefits that we can derive from them. And we learn, yeah, we learn from several literature that then from that we have some LM, GNN, and also large language model and ontology-aware multi-level classifications here. So the research integrates a large language model and graph neural networks, yeah, to analyze the compounds from the plant like Hoya species. Here the LM extracts information from scientific literature and cosmetic databases, while the GNN models yeah, they will discover the relationship between plants, compounds, protein targets, and skin pathways. Together, they can predict effects such as anti-aging, brightening, or moisturizing, even for compounds not yet tested in the lab. Yeah, this hybrid AI approach allows faster discovery of natural ingredients for skincare and wellness, grounded in both science and also tradition. Okay, here we can see the other case study about how graph convolutional network or GCNs can model immune interaction to accelerate vaccine. Yeah, yeah. This diagrams shows how epitopes, small parts of antigens recognized by the immune system, bind the MHC molecules, which present them to immune cells. Traditionally, predicting this binding requires years of lab work, but with the GCNs, we can represent both antigens and antibodies as graphs, capturing their structural and biochemical relationship. The model then learns patterns that determine binding strength and stability, enabling faster in silico prediction. This approach paves the way for AI-assisted vaccine design and immune modulating herbal research. And after that, we also have the architecture, yeah, to integrate multiple layers of AI. Yeah, here we have the large language models, knowledge graph neural networks, and also generative biology. So, for instance, begins from biomedical databases like drug banks and OMIM, which provide structured information about the drugs, target, and disease. Then we also use a language model like GPT-4 or BioBirds to generate embedding capturing semantic meaning from scientific text. Then combined with the graph-based features like similarity and adjacency matrix, allowing the model to understand both language and biological structure. And after that, we have a generative model to propose new hypotheses or compounds. Those hybrid designs mirrors how scientists think, connecting knowledge, reasoning, and also creativity at computational scale. And we come to the opportunity, yeah, because I think it's a lot of opportunity, as mentioned by Ivan earlier in keynote speech, yeah, that we have the mega biodiversity in Indonesia, and we also have a deep traditional knowledge, yeah, passed down through generations that now can be digitized and validated by using AI. And other thing is about the halal bioeconomy, yeah, that aligns with the global demands for ethical and sustainable natural products. And this is very important that we have AI talent, yeah, AI talent that's rapidly emerging with strong collaboration between universities, startup, and research institutions. And I think it's very nice that here we come together, meeting together from Pittsburgh, from IPB, and ITB, and other universities and institutions as well, that we can collaborate, yeah, as AI talents, that we can have research collaborations, yeah, to make this opportunity become larger and larger. And we also have the roadmap here. Yeah, we propose such a roadmap here, starting from the herbal knowledge graph, yeah, integrating data on plants, compounds, and their therapeutic relationship. Next, we can develop a herbal bio large language model specialized for ethnopharmacology and molecular biology. And after that, omics integration. Yeah. Here we connect genomics, proteomics, metabolomics to understand herbal effects of the system. Yeah. Then graph interference enables the discovery of new compound, target links, and the last one is AI safety layers that ensure transparency, ethics, and also protection of indigenous knowledge. Together, those 5 pillars guide responsible and scalable herbal innovation. And here, last but not least, yeah, we can conclude that there are 2 key messages. Yeah, the first is that generative AI can accelerate herbal medicine innovation from knowledge discovery and molecular prediction to formulation and personalized health solutions. It can open new doors for evidence-based, sustainable therapies grounded in our natural language. But the second thing, yeah, and also important, that the human expertise, yeah, remains critical. We can use the AI can analyze data, but only humans can ensure the safety, ethics, and cultural integrity. Together, the future of health innovation is that the AI will replace the human, but the AI will working together with human, yeah, together with us, combining wisdom and also intelligence to build a healthier and also more sustainable world. Okay, I think that's all from me. I return to Verry. Thank you.
Thank you so much, Dr. Wikan, for thought-provoking and technically rich presentation. You have given us a comprehensive view on how software engineering and AI can bridge traditional knowledge and modern healthcare innovation. Moreover, with some of the use case that you have described earlier, which are really eye-opening. And as you mentioned earlier, today we have also colleagues not just from IPB, but we have also colleagues from Editkoan University, Australia, Gunadarma, Andalas, Nusa Mandiri, Lampung, Nasional Makassar, Universitas Negeri Makassar, Jember, and etc. etc. I read on the attendance list here. Not to mention that we have also participant from Ministry of Health and BPOM, Food and Drug Administration, and other institutions and government bodies as well. So we have a quite complete ecosystem stakeholders in this webinar. Hopefully it will be continued with the further step, which is research collaboration and so on and so forth. All right, now to enrich our discussion, Pak Wikan, please stay in the room. We will be having a question and answer session after this. But before that, we are delighted to welcome our panelists Dr. Mira Dewi, Vice Dean for Academic Students and Alumni Affairs of Faculty of Medicine, ITB University. Dr. Mira, you ready? All right,
Yep.
so all right, thank you, Dr. Mira. Please show Dr. Mira impressive curriculum vitae. Ladies and gentlemen, distinguished participant, we can read on the screen Dr. Mira, Assistant Professor, Faculty of Medicine at IPB University. In formal education is Ph.D. in Medical Nutrition, Kansas University Medical Center in United States. Master of Science, Biochemistry in Bogor, IPB University, and Medical Doctor in Faculty of Medicine, University of Indonesia. So Dr. Mira will provide reflection and commentary on the previous presentation, particularly from the perspective of medical education, health research, and the integration of herbal medicine within the digital transformation era. Please welcome Dr. Mira Dewi to share her thought. Doctor, the virtual floor is yours. Please, Dr. Mira.
Thank you, Pak Verry. Assalamualaikum warahmatullahi wabarakatuh. Good morning and good evening to Pak Andi. First of all, I would like to express my gratitude and for being the part of this very important and exciting seminar or Pre-APFITA series. So congratulations to the committee, Pak Verry and also Pak Yandra and all the teams. And also again, to highlight what I have already mentioned by Pak Verry, that we are so excited from the Faculty of Medicine, IPB University, to collaborate with the speakers, the two wonderful speakers, and also the audience. So after this, hopefully we can together bring this AI work into the healthcare system in Indonesia, in particular. Okay, so I wouldn't. So I enjoyed the two presentations very much. And I am still learning about the AI, even though I have heard about the AI. But really, this is a disclaimer that I am really not AI expert at all. I've heard of that, and I'm trying to learn. And I understand that it's becomes a very important part of the healthcare system and also in medical education as well. So I wouldn't give my overview regarding the presentation, but I just want to share my thoughts about the two presentations. First, I would go with Pak Andi presentation. I'm so excited, and thank you very much, Pak Andi, for sharing. And I strongly agree that the generative AI is a major breakthrough in privacy preserving research, particularly in Indonesia. And also one thing that you highlight that it is enable where the access the real world health data is somewhat restricted here, but using this technology we can decipher many knowledge from that. As clinicians, I think that we need to also look carefully at the risks of using this high technology. First, that any AI tool used in healthcare, in my perspective, must undergo a rigorous clinical validation before influencing patient management decisions. Accuracy is important, but it's not enough. Also, it has to be explainable and reliable, and those two are equally critical. The second is that the health system here in Indonesia is, we know it's different from the US in terms of the digital infrastructure, for example, interoperability, clinician readiness, like I see myself, am I ready for this? And also that we are getting there, but we are still developing ourselves. And the third is that we must address bias and representativeness, like models developed in the mostly use the data sets from the Western countries, which might not reflect Indonesian patients' physiology, genetics, or disease patterns. So we need to do some sort of localized validation, maybe. That's what I thought. Again, I'm still figuring out this AI thing. So can I ask questions, Pak Verry, for Pak Andi?
Definitely yes, but please keep for a moment. We are going to enter a Q&A session, Dr. Mira, and you will be having the first opportunity to deliver the question. How's that?
Excellent. Excellent.
All
All
right.
right. So I will keep my questions. So I will move to my thoughts about Pak Wikan's presentation, which I'm excited because our focus in Faculty of Medicine in IPB University is herbal medicine, and my background is nutrition. So nutrition, herbal is part of nutrition. So we've been working on these specialties or focus in our research and as well as in education and community service, the Tridharma. So yeah, I fully agree with the message that you deliver that the AI can accelerate herbal drug discovery. I'm still learning about the graph neural networks, GNN. I remember last night I asked ChatGPT, hey, what is graph neural networks? Explain it to me. Again, as a clinicians, I think there are several key points that we need to further look at more closely. The first is that while the herbal intelligence pipeline from the literature mining to GNN or graph neural networks prediction and validation is impressive, I still think that we need to ensure that the AI generated predictions are biologically and also clinically validated. Even the best models, I feel that can produce correlations, but probably without causation. So in my opinion, the laboratory and preclinical confirmation is, as you also mentioned, that those two remain essential. Second is the standardization of and data quality. Because herbal formulation vary greatly depending on manufacturers, such as plant species, the growing conditions, the climate, the preparation methods, and everything. For the AI models to be reliable, so the decision must be on high quality, in order to limit the variability. And the third, we should consider, as already mentioned by both speakers, the ethical and regulatory aspects of this AI-assisted herbal research. I think the governments play important role in this area. We need clear governance frameworks which balance the intellectual property rights, the patient safety, because that's the most thing that matters for us, the health workers, and as well that the local wisdom of the herbal medicine. So for the closing, I don't want to close, but my final statement is like with the right collaboration between the technologists like Pak Andi and Pak Wikan, and clinicians like me and Dr. Ivan, and also the regulatory bodies. I believe some are here now joining this seminar. We, Indonesia, can truly lead in safe, evidence-based, AI-driven herbal innovation. I think that's from me, Pak Verry. Thank you very much for the opportunity.
The pleasure is mine. Thank you so much, Dr. Mira. Keep the question just for a few minutes from now. I believe you have a question to both distinguished speaker. All right. So thank you so much, Dr. Mira. Again, she has already shared about risk factor. Accuracy is important, but not enough. Data accuracy, ethical, and so on and so forth. All right, distinguished participant. Thank you so much again for joining us. And thank you again to all distinguished speakers, Dr. Andi and Dr. Wikan, for their excellent and insightful presentation, as well as to our panelist, Dr. Mira, for her valuable reflection and perspective. Now we are moving to the next session, which is Q&A question session. Q&A session. A time for all of us to engage, clarify, and explore the key ideas that have been shared today. Distinguished participant, if you have any question for our speakers, there are two ways you can participate. First, type your question in the, they will rewrite it down and we will read it out aloud on behalf of you. And second way is use your raise hand feature. If you wish to speak directly to the presenters, I will call your name and unmute your microphone when it's on come to your turn. Please mention your name and affiliation before asking question, and kindly keep your question brief and focused so that we can accommodate more participants. Before we begin, as I promised earlier, I would like to first invite our panelist, Dr. Mira Dewi, to start this discussion by addressing any question or comments you might have for our speaker. Dr. Mira, again, the virtual floor is yours.
Thank you. Such a privilege. Okay, first for Dr. Andi, for Pak Andi, because I'm working in the medical education as the in IPB University, where we have medical students. So I want to know from your perspective, to what extent do clinicians as well as medical students need to understand about the generative AI models, how they work? Do you think that it should be mandatory in medical curriculum? Because we have seen that many faculty of medicine have also included AI for medicine or in health system, but not yet mandatory. So I want to know what your perspective, because you mentioned in your slides the students, but how about medical students? I think that is one for Pak Andi. So should I, can I go to one more question for Pak Wikan?
Yes, please.
Okay, thank you. So Pak Wikan, my background is in nutrition, so I wonder, since we talk about the herbal ingredients, do you think this approach could also be extended to food-derived compounds, such as nutraceuticals, like or even animal-based nutrients, amino acids? We know that many amino acids and fatty acids are considered as functional. So what do you think? Can it be extended to food-derived nutraceuticals or even animal-based nutrients because all affects human metabolism and physiology? I think that's my two questions. Thank you.
You're welcome. You're very welcome, Dr. Mira. So I would like to give an opportunity to Dr. Andi Saptono to answer Dr. Mira's question. Please.
Thank you, Bu Mira, for the questions. I think that is a very important question. And I would like to share the answers from when we field that questions to my radiologist friend. And this is the Chief of Innovation Officer from a big health network here at the United States, the Advocate Health. And he said that if we're talking about the usage of AI, a radiologist with AI versus a radiologist with no AI, I'm sure, that's what he said, I'm sure that a radiologist with AI will be more competitive compared to radiologists with no AI. And I think that sentiment is applicable to any profession, health profession, that any health profession with AI will be more competitive compared to health professions with no AI. Of course, they still need to be a health profession. They still need to be a radiologist to be able to counter things like hallucination and things like that. They are not going to be replaced by AI, but understanding AI, knowing how to use AI appropriately is important. So some of the competencies, such as being aware of where the AI can be used as a part of the workflow. That's something that I think everybody needs to know. The strategy to assess which tool works, which tool does not work, that's also important for everybody to know as well. So yeah, that would be my take on that.
Thank you, Dr. Andi. Bu Mira, do you have any follow-up question on that one or comment?
Nope, I totally agree. Thank you very much. We are considering making it mandatory for our students here. Thank you, Pak Andi, Pak Verry.
Sounds great. Sounds great. Thank you, Dr. Mira. All right, so moving to the next question, I would like to give opportunity for Pak Wikan, Dr. Wikan.
Okay. Thank you, Bu Mira, Pak Verry. Very interesting and provoking question, yeah, for the whether the approach that we have can be applied to other things, yeah, from herbal to the nutrients, especially for the animal-based nutrition. The thing is, yeah, I think it's just similar that first, whether we can find literature, we collect all the literature about the nutrition, yeah, since there are also some benefits, yeah, of the nutrition. This will make you have a good health, for instance, and this one going have a good growth hormone and so on. Yeah. I think it is already written or already researched by the researcher in nutrition. Yeah, just like Bu Mira. Yeah, you have a very good knowledge about the nutrition, and then we will collect all those knowledge and put on the knowledge management to have a good structure, and then we will try to make the structure of the or component of the material, and which one we will spare it, which goes to this benefits and for other benefits, for instance, and then if we want to make some new benefits, for instance, then we can derive. But the thing is, actually it's also simulations. Yeah, it's what is it, in silico. Yeah, if it says we contrast in silico and in vivo. In vivo, we applied directly to the creature, yeah, the animals or the human. But in silico, it means that we make experiments by using the computer simulations. But this is not sure whether it's correct or not. Yeah, but at least it will reduce the combination with reduce the expense, yeah, the money that goes to make a experiment in vivo, because if we try to apply it directly to the human or animal, then it costs very expensive. So I have asked to my pharmacist experts, friends, and he now doing research in the what's it's called science pharmacology, yeah, or so or computational pharmacy, yeah. So using a computational approach to try to solve the pharmacy's problems, and it increase his productivity to get new drugs. Yeah, and that's the thing. I mean, we should what is it? validate by using the real experiments, but the simulation will reduce the cost, so we don't have to wait until all the materials and the results of the experiments goes into the real experiments, because experiments using the human or animals is, I think, also related with the ethics. Yeah, it's not easier to get the ethics. I think that's the idea. I think that's also, yeah, we can use the similar approach to to get the benefits of nutrients. Yeah, I hope it's answer your question. Thank you.
Thank you, Dr. Wikan. Bu Mira?
Thank you so much, Pak Wikan. We are eager to collaborate. I think we have many things to work on in the near future, hopefully. Thank you so much.
Yeah, you can contact me via my email. Yeah, Wikan at Informatikology.
Sure, thank you.
Welcome.
Definitely, that will be the one of the main aim or goal to have this webinar, which is the collaboration. So thank you, Dr. Wikan, for answering the question from Dr. Mira. So I learned two things here. First, from Dr. Andi, that he mentioned any occupation with AI will be more or competitive in comparison with the occupation without AI. And second thing from Dr. Wikan, he mentioned about the knowledge acquisition is one of the important thing to be able to provide a better result from the generative AI. All right, thank you. So now we are moving, Dr. Mira, thank you for the question. We are moving to the next question from the participants. Committee, please show the first question. I have read several questions available in the chat box. PPT, could you please move to the next? All right. The first question is from Hilman Solih. Oh, this my college in University of Muhammadiyah Cilengsi, to Pak Andi Saptono. But of course, Pak Wikan, I'll give you also an opportunity to answer the question. The question is, based on your experience, how trustworthy and accurate are the results generated by generative AI when it's applied to new problem-solving contexts? Pak Andi, the time.
Yes, thank you so much for the questions for Hilman. That's a very, very difficult question to answer. So it's a really good question. Trustworthy and accurate, as I have demonstrated in my case scenario, accuracy sometimes does not translate well into trustworthy, because there are a lot of nuance until we can say that an AI is trustworthy. It needs to be factually, it needs to be checked factually. The accuracy needs to be there. The validation needs to be there. The references are grounded with real references. So for example, if we just ask ChatGPT, sometimes it says, oh yeah, Andy says so and so. When you click the link, it's not there. So how trustworthy it is, right? So, and then we also need to check with the algorithm that counters those kind of hallucination. Do we use RAG, for example, the retrieval augmented generation? Do we use fine tuning? Do we use the latest model, for example? If we compare between GPT-4 and GPT-5, the quality is also different, because GPT-5 has more parameters, ingested more data, have different tuning, have reasoning model, etc. So those are the follow-up questions that we need to ask first before we can answer this question. So let's say, how trustworthy and accurate are the results from GPT-4 versus GPT-5? Now that's where we can start answer this question. So what we've seen, the trend is, of course, a larger language model is better. It's more trustworthy. It's more accurate. But the question comes into, for example, is it applicable? So, for example, some of my client, sorry, some of my client ask sometimes, I have a wheelchair and I need to, for example, join an activity. The model can provide the best way to do that. But if the person themselves does not have that tool, so let's say, oh, to be able to participate in the hockey, you need to use this kind of wheelchair. But if they don't have that wheelchair, even the best answer from the AI becomes not accurate because it does not fit with the person's context itself. Maybe the next best answer is the most accurate one because maybe that wheelchair is the one that the person have instead. And so the technique that can provide more information, more contextual information for the person needs to be looked into as well. So there is no easy way to answer these questions without understanding what are the model, what are the additional information provided, what are the contexts are being provided as well. So hopefully that will help give more thought into the nuance of this question.
I believe it does. Thank you so much, Dr. Andi. Now, Dr. Wikan, would you like to add on what Dr. Andi has mentioned regarding this question, please?
Yeah, I agree with Pak Andi said that about the trustworthy and accurate. I just wanted to add that yeah, we still need a human to validate it. So it means that the person should be more, what is it, more intelligence than AI. so and know but what is the right and what is wrong, because AI, especially generative AI, they don't have ground truths. Yeah, so it's based on the what they be fed up. Yeah, so they will fed from some fact, but the thing is sometimes the data is not correct. Yeah, the data that fed to the AI is not correct. So the people should know what is right and wrong, and he make corrections to the data or results that given by the AI. I think that's the idea. So we don't have to put all of our trust. We just very carefully see the results, and still, yeah, by using our expertise, by using our experience, we put the right one, our experience and our expertise to being fed to the AI, yeah, to make it better and more trustworthy. I think that's the idea. Thank you.
Thank you, Dr. Wikan. And in a medicine aspect, we call it as a second opinion. So AI is just a second opinion. We have to be ready ourselves with the more information before we ask the question. Thank you, gentlemen. I'm now moving to the second question. Committee, please, next to the second question.